Good morning, students. Today's last class will see about the fracture of the clavicle introduction part. This class will see about case study about fracture of the clavicle. For case study about first is the subject examination. We will see about first demographic data. Patient name is the Sadish. Age 25 years. Gender male. Occupation college students. Then OP number, IP number. Then we'll see the chief complaints of this case. Chief complaints in this case is the patient is a pain over the shoulder joint, pain over the anterior shoulder joint. Then unable to move the shoulder, unable to move shoulder. Then swollen over the shoulder. Then this case the right side shoulder and right side shoulder joint pain and unable to move. Then we will go for past medical history. Past history. This is no history of diabetic, no history of diabetic, hypertension and asthma. Then no trauma history, no past trauma history, no past surgical histories. Then present medical history will go for a 25 years or male student came in the football match. The fall with the ground is a fall, land on the direct blow to the shoulder, direct blow on the shoulder joint. Suddenly pain started, unable to move. Then the shoulder joint is a very swollen on the shoulder joint. Then movement restricted. Then you will go for, at that time you will go for ambulance. They will go for a emergency procedure in the hospital. Then you suspected for the clavicle fracture. Then we'll go for the X-ray findings. X-ray findings are mainly shown about the AP view. You see, then X-ray findings see about the clavicle fracture in the shaft region. Then you will go for undisplaced, mainly seen about the undisplaced shaft fracture. Then the orthopedician will choose for the not for the surgical management. Go for the engage. You will go for the conservative management. Mainly go for figure of eight bandage and with cuff and collar sling. The immobilization period for the 3 weeks. 3 weeks immobilization period. Patient as the doctor prescribed for the pain management, the pain analgesics. Then we'll go for physiotherapeutic exercise, mainly for the elbow, wrist and finger movements are full movements. Then shoulder movements are the only go for isometrics. RC strengthening exercise will go for the shoulder joints. These are followed by 3 weeks. Then after 3 weeks we will revisit the hospital. Then we will go for the started the mobilization phase. You will go next progress to physio. Progression for them. Progression is the main for elbow, wrist and finger joints will go for resisted exercise. Then 1 kg started the 1 kg, the elbow flexion extension, then the wrist movements are started. Then shoulder is the remove the cuff and collar slings. You go for the short lever pendular axis. Short lever pendular axis started. Then we will go for isometrics of the RC, rotator cuff muscles, then deltoid, then coracobrachial muscles are started. Then we will go for assisted shoulder movements. We supported the shoulder, left shoulder. We will go for the up to 90 degree, started the movements. Okay, students, this is stop with the class. Next class. Thank you. Today see about the physiotherapy part. Shoulder movements are started. Shoulder movements is there. The first we will initially started there or 45 degree movement started. Then we will progress for the 50 50 degree, then 70 degree, up to then we'll go for 90 degree. This moment the compulsory for the pain is present. That kind of the patients will choose for cryo or hot water fermentation is applied. Then we'll go for the movements. Then we'll time movements time will go for the without cuff and collar slings, and with the rest period will go for the cuff and collar sling. Choose for the cuff and collar sling. Then we'll go for the avoid the weight bearings. The upper limb weight bearings movements are avoided. Then we'll go for then progression for okay student. Thank you.